Hello, my name is Jennifer. Welcome to the training workshop for GPH728 Health Literacy and Plain Language. The overview for this workshop includes 2 key areas of concern and why these are important, a definition of health literacy, national policies, programs, and interventions related to these 2 key areas of concern, ethics and how they relate to health literacy communication, a small group exercise, and a summary of best practices related to health communication. The 2 key areas of concern addressed in this workshop include addressing language and cultural differences and encouraging patients to ask questions. So why are these important areas of concern? Language and cultural differences are important because 35% of Brownville residents are foreign-born and speak a language other than English at home. Poor communication leads to increased health-related errors and cost and poor health outcomes. There has been a 14% increase in the population of people who speak a language other than English at home between 1980 and 2012, as seen in this chart. And addressing and being aware of language and cultural differences can alleviate patient-provider health communication issues and impact. There is also a large percentage of limited English proficiency adults in the United States in general and in Brownville residents. An example includes a study of Latinas in New York City, which found that those with lower health literacy were 16.7 times less likely to have ever had a Pap test. Encouraging patients to ask questions is also an important area of concern. Regardless of patients' level of health literacy, they're generally scared, sick, or overwhelmed when they come in, so that can impede their clarity. Encouraging question asking can alleviate these difficult feelings. Strategies to improve health literacy are distinct from strategies geared towards language and culture. So, encouraging question asking can help with all of these areas. Also, encouraging question asking makes patients active participants in their healthcare. Interpreters and translators can help bridge language and cultural gaps. Lack of clarification is what leads to poor health outcomes. So providers should encourage patients to ask questions in order to clarify any confusion. Embarrassment or the rushed any questions after a visit can make patients passive participants, and we want to make them active participants. An example includes the story of an elderly Navajo grandfather and his granddaughter who arrive at a clinic. The man has a leg infection and has limited English, but his granddaughter speaks fluent English and has limited Navajo. So she has difficulty translating medical information into Navajo. The man eventually becomes frustrated and just agrees with the doctor that he understands everything. He ends up turning to traditional medicine instead, and the leg ends up being amputated. In this kind of situation, what could have been done? What communication barriers led to this result? So, a working definition of health literacy includes the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. That is the Institute of Medicine's definition. It includes a set of skills and interactions on the part of the individual, the healthcare system, education system, and cultural and societal context. Here you can see a health literacy framework where all of these factors interact with each other to create a definition of health literacy. So overall, health literacy is the ability to interpret and understand health information on the part of the patient. A common example is the ability to take a medication. So what health literacy is involved in this? It includes the ability of the patient to read, understand the prescription bottle, understand the purpose of the medication, side effects, risks, and benefits, and the ability of the patient to obtain and clarify any missing health information. Health literacy involves basic reading and numerical tasks required to function in the healthcare environment. And for this example, even something as simple as taking a medication involves an interaction of many skills in order to do it correctly. Overall, health literacy is needed for patients to make informed medical decisions and to be able to follow the instructions of their healthcare provider and understand their health in general. So some national policies, programs, and interventions related to health literacy and the two key areas of concern includes the Office of Minority Health National Culturally and Linguistically Appropriate Service Standards, also abbreviated as CLAS standards. It is a national health literacy movement that aims to ensure cultural competency training for providers across the country. So state and local agencies strive to implement these CLAS standards into their policies, planning, and collaboration activities. This is important because it directly addresses health inequities through a tailored approach which focuses on the patient's culture and language. There's also language access services, which are actually required for any healthcare organizations which receive federal funds, such as Medicaid or Medicare. So here we will talk about ethics and health literacy. There are 4 key ethical principles in healthcare, and they include non-maleficence, beneficence, autonomy, and justice. How do these apply to patient communication? Maleficence basically means to do no harm. Beneficence is the idea that there's more than just avoiding doing harm and includes acts of kindness and courtesy not expected by typical strangers that are expected of healthcare workers. Autonomy is the idea that we are to respect others for who they are, and it includes 2 conditions. Patients should be competent to make decisions, and they should be free of coercion. Justice includes 2 types of justice, procedural and distributive. Procedural justice is also known as due process, and distributive justice is when you determine what is fair when dividing burdens or benefits. So how are these 4 key ethical principles related to health literacy? In general, providers should do no harm and be kind and provide courtesy to their patients. And also, in terms of autonomy, in order for a patient to be autonomous, they should understand and be able to effectively communicate with their provider and understand what's going on with their health. This is also related to justice, because you cannot provide justice if you are not communicating effectively with your patient. So here we can go over the small group exercise. You will form small groups of 3. One person will be playing a provider, one person will be a patient, and there will be a 3rd person serving as an observer. Each group will receive a summary scenario, which includes a script for the provider and the patient, and overall the exercise will take 45 minutes to complete, and then we will reconvene for discussion and feedback. The purpose of this exercise is to aid in identifying the use of cultural and linguistic skills and strategies when interacting with patients, while also encouraging patients to ask questions at the same time. So the 2 key areas of concern that will be addressed by this exercise includes addressing language and cultural differences and encouraging question asking. So In terms of language and culture, think about when and how to use translation services. How can you use plain language and common words and the teach-back method and other communication strategies to effectively interact with your patient? In terms of encouraging question asking, think about what low literacy red flags exist. You should anticipate the patient's questions and understand how and when to use translators and interpreters. The materials for this exercise will include the handout with an overview of our scenario and learning objectives. It will also include a list of low literacy red flags and communication strategies to help you communicate with your patient, including the teach-back method and why is it hard for patients to ask questions, and also a list of contact information in order to obtain translator and interpreter services for your hospital. Also, it will include the summary scenario, the 2 scripts, and a notepad for the observer to take notes and give feedback at the end. So, part 1, you will break into small groups of 3. Together, you will define health literacy, discuss the red flags, and determine when it is appropriate to obtain translation services. Part 2 will be 10 minutes long, and you will read the scenario and perform the exercise. Part 3 will be a post-scenario discussion, which will be 20 minutes, and you will go over the observer's notes, discuss the scenario in relation to the provided skills and techniques list provided, and the cultural appropriateness of the interaction. So what were positives and negatives of the interaction? How could you improve it? And what key strategies and skills did you use, or what was missing from the scenario? Each group should provide 2 takeaway points to share with the bigger group in general at the end to improve future patient interactions. Each of the key takeaway points should relate to one of the key areas of concern. So overall, the summary of best practice related to health literacy and these 2 key areas of concern include a list of what to avoid and what strategy and alternatives you should use instead. So you should avoid using medical jargon. You should not assume that patients understand what you have told them. Even if they say they understand, it is important to be sure that they are not just agreeing with you to end the session. You should avoid closed-ended questions, meaning quick questions that only require a yes or no answer, such as, do you understand? And you should not speak too quickly or rush the appointment. Strategies and alternatives include using plain language. You should know your audience, including their culture, their language, and their age group. You should also make use of language access services, including translators and interpreters, and these should be prepared prior to the patient's arrival. You should use the teach-back method and invite questions and even insist on questions. You should also be aware of commonly asked questions that the patient might have that they may not ask, so you can go ahead and ask them ahead of time and anticipate what kind of questions they may have based on the type of appointment it is. And you should also offer reassurance to the patient, as they may be nervous or scared because they're sick and they may be overwhelmed by the amount of medical information. Thank you.